Hello, it's Eric, and this is Strong Medicine's Intern Crash Course. Today, I'm running through 10 quick tips on how to be an effective intern, focusing on rounding on the inpatient wards. When calculating when you need to arrive at the hospital in order to be finished pre-rounding on time, give yourself at least 15 extra minutes beyond what you anticipate will be necessary. You may run into a patient's family who wants an update, or a patient may have gotten sicker overnight and require more investigation and immediate intervention that could delay you seeing the rest of your patients. And if you end up not needing that extra time, you can just use it for getting a jump start on progress notes. If you have a med student who does not seem occupied or otherwise busy, ask them if they'd like to pre-round with you, but make sure they know that they're not obligated to say yes if they have something else going on. If you're fortunate enough to have an attending or resident who offers you the choice of either walk rounding or card flipping in the team room, as a general rule, choose walk rounding. It might take a few more minutes, but will be more fun, more educational, improves communication with your nurses, and the patients appreciate it. If your attending really did not want to walk round that day, they would not have offered you the option. And when you are on bedside rounds, include the bedside nurse. This means not only asking the nurse to report relatively objective information, but also asking and valuing their opinion about the day's plan. Ultimately, treatment plans are determined by the physicians, but most nurses will have more experience than you. So if your patient's nurse expresses reservations about your plan, take an extra minute or two to discuss it together to better understand their concerns. When presenting to your attending a new patient who had been admitted by the night team the night before, do not read the night team's H&P verbatim. Unless your attending states otherwise, they usually will have already read that note and will be fine with you just providing overnight updates and focusing on your assessment and your plan for the day. No matter its length or complexity, every oral presentation should include a 1 to 2 sentence summary statement. This is certainly not the only acceptable structure, but one which I find works well is to string together 4 components: age plus gender, highly relevant past medical and social history, primary symptom or symptoms using descriptive adjectives, also known as semantic qualifiers, and a summary of the most relevant objective findings grouped into clinical syndromes when possible. For example, in summary, Ms. Williams is a 65-year-old woman with a history of hypertension and 50-pack years of smoking, who presents with subacute progressive dyspnea and episodic palpitations. Objective data is most notable for a blood pressure of 160/110 and evidence of volume overload on exam and chest x-ray. And whether or not you use this particular format, the summary statement should never be the same word for word as the chief complaint, a mistake which is far more common than you might realize. At least occasionally, you should walk around alongside other interns on the team as a group. This gives you the opportunity to observe another style of presentation and bedside interaction, and will expose you to additional learning opportunities such as physical exam findings that you otherwise would not have seen. Never speak disrespectfully about patients or their family members during rounds, even if doing so during card flipping rounds in the privacy of the team workroom. While we all will experience occasional moments of frustrating interpersonal dynamics, and the patient is not always right, disrespecting them is unprofessional and always a bad look. If you notice that a consulting service is in the hallway preparing to round on your patient, tag along. You can provide details about the history or hospital course that they may not otherwise know, and you can hear about their thoughts on the case in real time. And you'll be able to learn things in that particular field that your resident and primary attending might not be able to teach you. And the last tip for this video, if it's a day when you'll need to leave the wards right after lunch, for example for your continuity clinic, remind your attending of that at the very beginning of rounds. This will hopefully prompt him or her to round with you on your patients first, and perhaps cut down on teaching just a little bit on that particular day in order to leave you enough time for your orders and notes before you need to leave.